video, we're going to talk about some of the breathing techniques. So the first one we're going to look at is what we call up breathing. So this is when the uterus is pushing upwards to develop that muscle at the top to open the cervix. We're going to do what we call up breathing. So this is where we breathe in for 4, we hold for 4, and we out for 8. And once more, in for 4, we're going to hold for 4, and we're going to breathe out for 8. So what this is doing is allowing our body to, if we visualise when we're doing this exercise that our uterus is moving upwards, if we visualise that as we're breathing out, we're pulling up through our tummy, up, up, up. Sorry, as we're blowing out, pulling up, and that is our up breathing. So this is to be used during contractions until we're at 10 centimetres dilated. So the next one we're going to do is our down breathing. So this is when we are actively pushing baby out. So this is where we're going to breathe in for 4. When we breathe out, we're going to pretend we're blowing up a balloon. So this is my balloon. With pursed lips, can you see? Now, as you're doing this, you will feel that your pelvic floor pushes outwards. Even now, as you're practicing this, you will be able to feel it. So I'm going to share with you a little exercise in another video that's all about what I call poo breathing. And this is to help you understand how this technique is so powerful to be used in pushing out your baby. So another little breathing exercise you can do is between contractions to get some oxygen flowing around your body. You can breathe completely normally to get yourself to relax, or you can do what we call puff breathing. So this is pretty self-explanatory, but we're going and I'm sure as you're doing this exercise, as you practice, you will be able to feel your pelvic floor moving up and down, and that is just to give it a little bit of vibration, to give it get it to relax in between contractions. So the next, it's kind of to do with breathing, but more to do with your jaw. So I'm going to talk you through this in this video because I think it's important to understand that a lot of the time when we're stressed in general, we tighten our jaw. So often, if we learn to relax our jaw, it actually relaxes our pelvic floor. So that's a nice little saying to remember. If you relax your jaw, it relaxes your pelvic floor. So all we're going to do is open and shut our mouth a few times and wiggle our jaw side to side and up and down a few more times. We can also do some little circles on the side of our face. And this all helps to relax that jaw area, which relaxes your pelvic floor. So the last thing I want to mention in this video is in between contractions, you can do a little exercise where you wiggle your toes, because this sends the blood all the way down from your heart, all the way down to your feet when you're wiggling your toes, and it helps just get the oxygen through your whole body, as I say, from your heart all the way through your uterus, all the way down to your toes. So I hope this video has been helpful, all about some breathing and relaxation techniques.